Everybody, I think we're ready to get started. Good afternoon. Hello, everybody. My name is Bridget Degnen. I am the Cook County Commissioner in the 12th District, covering parts of Chicago's north and northwest sides of the city of Chicago. I'm here today with County Commissioners Donna Miller, Maggie Trevor, Kevin Morrison, Scott Britton, Stanley Moore, Bridget Gaynor, Anthony Cazada, Alma Anaya, and we also have Alderman Scott Wagas back here. And I'm here with County Board President Tony Preckwinkle and many of our advocates in the fight for health care justice for women. And Monica Gordon. In Cook County, our budget reflects our moral compass, one centered in freedom, autonomy, and equity. The budget amendment we passed today allocates $2 million from the Cook County Health System's budget to community organizations that provide wraparound services and reproductive health services. I want to thank my colleagues here today for joining me in allocating resources to support women, and specifically to Commissioner Miller, my co-sponsor, for her career in advocating for reproductive health and for being an original sponsor. I also want to thank the leadership at Cook County for their collaboration, including Kathy Chan at Cook County Health, who worked diligently to ensure this got done with collaboration and flexibility. I also want to thank County Board President for supporting this, Tony Preckwinkle, and most importantly, our Advocates in Justice Personal PAC, Chicago Abortion Fund, Carla, and the City of Chicago for their tireless work for women. Make no mistake, anti-choice advocates with control of the federal government and the reversal of Roe leave reproductive health access under attack in America. Many members of the Senate and the House still oppose abortion rights despite their constituents being in support, like a vast majority of Americans. The Senate and the House also voted against a bill this year that would have protected the simple right to contraception. We should not be surprised if under Trump's leadership, the Department of Justice weaponizes the Comstock Act, a bill from 1873 to attack abortion providers, medications, and contraceptives. As we speak here in Illinois, reproductive health care providers are reporting a huge spike in calls for abortion pills, birth control, and emergency contraception due to their fear of what could be coming next from Washington, D.C. Our first job as public servants is to protect the health and safety of our residents, and reproductive health is fundamental to the health and safety of people in Cook County. Illinois is a reproductive health haven surrounded by abortion care deserts because we are a pro-freedom state. That's why state legislators passed the Reproductive Health Act and HB 40 before that. I'm so glad that we have a governor who will fight to ensure access is protected. The City of Chicago also allocates funding for abortion care because it is health care, and we all agree that health care is a human right. This doesn't mean that we should idly sit by and wait for a tax. We can all agree your zip code and your income should not determine your rights and freedoms. With this amendment, we in Cook County are being proactive in expanding and protecting necessary care. So here's what the budget amendment we passed today does. It ensures an additional $2 million will go to the work of community organizations providing wraparound services for those that need abortion care. The funding will be used to cover the course of reproductive health services, transportation, lodging, and health care and child care for individuals. By passing reproductive health equity, this amendment today, we are sending a clear message to people in Cook County that we respect you and that we care about you and we care about your health care choices and your needs. Again, I want to show my deepest appreciation to the organization and advocates across the state and country that work tirelessly to protect freedoms and autonomy. By ensuring this additional funding to organizations providing this critical care, we're making it very clear that no matter who is in the Oval Office, we as a county have chosen freedom, bodily autonomy, and equity. So thank you for being here. I'd like to next bring up County Commissioner Donna Miller.
Good afternoon, everyone. Good afternoon. I want to thank my colleague, Commissioner Degnen, for bringing us all here today, and all of our colleagues who are joining us. As we know, we are living in very precarious times when it comes to women's rights, especially a woman's right to bodily autonomy and the ability to access reproductive health care, the health care that they need. And there is a real possibility it can get worse. Although we are blessed to live in a county and a state that believes in a woman's right to control her own body and seek the health care she needs, as one of the largest public hospital systems, we must prepare to augment our ability to assist women who need access to reproductive care and wraparound services. I just wanted to go through a small timeline of how we got to where we are today and how this amendment proposed by Commissioner Degnen and all of us sponsors here is so important. In 2010, I was privileged to be part of Illinois had a parental notification laws put in place that required parents of minors to be informed about an abortion procedure. In 2011, anti-abortion measures were introduced in the Illinois legislature. They did not pass. In July of 2013, the Supreme Court upheld Parental Notice of Abortion Act of 1995, making it mandatory for physicians to notify a minor's parents 48 hours before an abortion. This ruling ended years of legal challenges, and a law went into effect. In 2017, we passed House Bill 40 here into law. I was there in Springfield. This was a landmark bill, and it removed the trigger provision that would automatically make abortion illegal in Illinois if, at that time, Roe v. Wade were overturned. And HB 40 also expanded Medicaid coverage for abortion services. In June of 2019, the Illinois legislature passed the Reproductive Health Care Act, signed by Governor Pritzker. In October of 2021, the Illinois General Assembly also passed legislation to repeal the Parental Notification Ban. Then, in the post-Dobbs decision of June 2022, following the U.S. Supreme Court's decision to overturn Roe, Illinois became one of the central states to provide access to abortion in the Midwest. That is where we are going to be where we are today. The fall of 2022, Illinois allocated additional funding to support abortion providers to protect out-of-state patients and providers. And in 2023, Illinois continued to expand protections for funding for reproductive health care, particularly in response to the demand from individuals traveling from other states. These legislative efforts in Illinois have aimed to strengthen data privacy for abortion seekers and protect reproductive health care providers from the liability based on actions from these more restrictive laws. Our 2024 presidential election is the first to take place since the Supreme Court overturned Roe. And sadly, although some states passed ballot measures ensuring some degree of access to abortions, other states have become more restrictive. Throughout the years, Illinois has actively worked to strengthen and protect abortion rights, in stark contrast to restrictive policies seen in many neighboring states. Illinois and Cook County is an island in the Midwest for women seeking reproductive health care in a safe and caring environment, and this is why these policies ensure the freedom and right to bodily autonomy for all women. That's why I am so proud to stand here with Commissioner Degnen as we sponsored this amendment in our 2025 budget to secure $2 million of funding support to community organizations providing reproductive health care, wraparound services, transportation assistance, and lodging and child care services. As a Black woman who has been in this fight for decades, almost, It's really important that we stand together. I just saw an article in the New York Times today or the other day that said that Black women are tired of being in these fights. Women are tired of having to have these same conversations for decades. That's why this amendment is so important. It is about reproductive health equity. I am so proud to be in full support and signed on with all of our fellow commissioners as co-sponsors. I want to thank you all for being here, and now it is my great pleasure to introduce Cook County Board President Tony Preckwinkle.
Good afternoon, everybody. It's good to be here today among friends and advocates for reproductive health. I want to thank Commissioner Bridget Degnen and Commissioner Donna Miller for their leadership on this issue. I'd like to acknowledge again the commissioners who have joined us. Commissioners Anaya, Britton, Gaynor, Gordon, Kevin Morrison, Casada, and Trevor. We're very grateful for your presence. Earlier today, the Board of Commissioners unanimously passed our $9.9 billion budget. It's an immense responsibility to put together thoughtful budgets that provide services while being mindful of our future obligations. I'm proud of what we've accomplished and look toward the future and the positive impact this budget will have on our county and its residents. This budget reflects the county's continued commitment to building a stronger, fairer, and financially secure future for all of our residents. And for the first time, it includes a historic $2 million investment in reproductive health. This is above and beyond the essential services that Cook County Health already provides. This is significant, and this investment comes at a pivotal moment. At the federal level, we're facing an incoming administration that seeks to continue reversing course on women's health and reproductive rights. This is a dangerous and disturbing policy question that puts the health of all women at risk. But as you know, abortion rights are protected in the state of Illinois and Cook County. This is important, especially because we border 3 states, Indiana, Kentucky, and Missouri, where abortion is banned. In fact, because of this, Illinois has experienced the largest increase of patients traveling from out of state for abortion care. We recognize this reality and we're stepping up with more support. With the additional $2 million in our budget, we will provide grants to community organizations that provide wraparound reproductive health services. These organizations help cover the cost of everything from hotel stays and travel to medical bills for people seeking abortion care. I'm proud that Cook County is doing its part in this moment to help those in the state and those traveling from out of state. Illinois is a refuge for those seeking access to reproductive health care. It's critical that local governments like ours step up. We will continue to rise to the occasion. Once again, thank you to Commissioners Degnen and Miller for championing this important work, and thank you for all who continue to fight for reproductive health. Cook County is with you. Thank you so much, and I'd like to bring to the podium Sarah Garza-Resnick from Personal PAC.
Good afternoon. My name is Sarah Garza-Resnick. That's S-A-R-A-H-G-A-R-Z-A-R-E-S-N-I-C-K. And I am proud to be the CEO of Personal PAC. For over 35 years, Personal PAC has been the champion in Illinois for abortion access. Our sole focus every day is to make sure that abortion stays safe, legal, and accessible here in Illinois. I am so proud, and all of the residents of Cook County should be so proud of every single commissioner who voted yes on this bill. It is because of Commissioner Degnen and Commissioner Miller and Cook County Board President Tony Preckwinkle that you should feel safe here in Cook County. We are under assault. Full stop. There is a war on women. And you have to know that in Illinois and in Cook County and in the city of Chicago, your elected officials have your back. As Commissioner Degnen commented, a budget is a moral document. And our morality here is with the will of the people of Illinois. And it is that abortion care is health care, and that the government should have nothing to do with our health care, full stop. Since Trump handpicked Supreme Court justices overturned Roe, We have had to deal with the reality every single day, and every day the elected officials of Illinois work tirelessly to make sure that women and pregnant people do not face the most unfathomable outcomes that women across this country are facing. Without critical access to abortion care, what we have seen unfold in this country is that we are dying. And every single elected official standing behind me does not think that that is correct. So we are so grateful to the board for voting yes. We are so grateful to the advocates and the providers and the activists that we stand arm in arm with every single day. Illinois is here, we will keep our doors open, and we will make sure that women always have access to health care. Thank you. We're gonna, Claudia. I call up Chief Medical Officer Dr. Claudia Fagan.
Thank you. I'm Dr. Claudia Fagan, Chief Medical Officer for Cook County Health. I'd like to recognize and thank President Preckwinkle for her stalwart advocacy for reproductive rights. She has been a true champion in this arena for her entire career. I would also like to thank Commissioner Degnen and Commissioner Miller and the entire Cook County Board of Commissioners for their support for abortion care at our health system and across the county. Access to abortion is not just a matter of personal choice. It is a health and social imperative. The ability to decide whether or not or when to become a parent is fundamental to a person's autonomy, dignity, and equality. Denying this right disproportionately impacts historically marginalized communities and can limit opportunities for education, employment, and economic security. We are fortunate to live in a state where an individual's right to control their own body and destiny are the law of the land, but reproductive rights are under assault across the country. As a healthcare provider, we are proud to prioritize the needs of those who need care the most and ensure that all birthing people can have access to safe and legal abortion care. Cook County Health offers medical and surgical abortions as a part of our full-service reproductive health care program. We also work closely with other providers and community groups and referral pathways to ensure all women can get the care they need. Thanks to the support of President Preckwinkle, Commissioners Degnen, Miller, and others, we are setting aside $2 million in the 2025 fund, $2 million in the 2025 to fund community groups that support people in need of abortion care and to defray the cost of procedures and other related expenses. The details on how these dollars will be dispersed are to be determined, but we are grateful to be able to play a larger part in ensuring ongoing access to abortion services and reducing barriers to care. Thank you. Next, Commissioner, to Kartisa Sharif.
Good afternoon. My name is Qudsiya Sharif. I am the Deputy Director with Chicago Abortion Fund, and I'm so proud to say that today marks a time when all levels of government, the City of Chicago, Cook County, and the State of Illinois have all pledged to invest in reproductive health care access. The Chicago Abortion Fund is Illinois' statewide abortion fund. We support thousands of people each year seeking abortion care with appointment funding, travel and logistical needs, as well as emotional support. Many of those people are getting care here in Cook County, and we see every day on our helpline what it looks like when people face barriers to getting basic, essential health care. Every investment in the abortion access ecosystem right now is a life-changing one. We know that Illinois' strength is a result of the collaboration between those of us on the ground at abortion funds and clinics, key advocates like Personal PAC, and our champions at all levels of government. This investment comes in a critical time. So many people in Illinois, in the Midwest, and beyond are relying on providers across Cook County to get the health care that they want, need, and deserve. And we are bracing ourselves for the continued attacks on abortion. But investments in abortion funding and travel support are life-changing, as I said, and life-saving for the people we work with every day at the Chicago Abortion Fund. For the CPS student who didn't have family support for her decision to get an abortion, who we were able to help with rides to and from the clinic, appointment costs, and finding an appointment that worked for her school schedule. For the recent migrant who needed a hotel room as she underwent a medication abortion, as she didn't have the privacy in the shelter that she and her family were staying in. This investment from Cook County has the power to make abortion care not only an option, but truly accessible for people who are facing barriers like the 400+ callers we support every week. We are so grateful for the leadership of Commissioner Degnen, Commissioner Miller, and President Preckwinkle, for all of the amendment's co-sponsors, for the commitment to bodily autonomy, and to the board for choosing today to invest in abortion access at this extremely critical moment. Thank you all so much.
Thank you. Go ahead. You're good. I think you're the last one. Again, I want to thank everybody for being here, and for all the electeds and advocates. We're happy to take questions if you have any.